the system won't be able to cope without adding any detail to that. Or we can answer your question, sir. And you asked, what's the timetable, what are the pilots? How are the health and social care systems in North West London going to work together to prevent as many people as, at the moment that are going to acute hospitals going? Surely that's a good ambition to have, isn't it? Less frail, elderly people falling seriously ill and ending up in hospitals. And
kill them all.
Don't
let them live.
If you'll let me, I'll answer the question with some detail. I'll answer the question with some detail rather than just with dramatic phrases. So at the moment, across North West London, across the Tri-Borough area, so Hammersmith, Fulham, Kensington, Chelsea, and Westminster, we are designing a £50 million integrated service provision between GP services, social care services, to better keep people well in their homes, including a redesign and massive further investment in home care. So that people who are frail in their home will receive a better quality of home care to keep them well. We're talking about.
Speak. Let him answer.
We're talking about a new, free at the point of use investment in reablement care for people going out of hospital, so that if you go into hospital because you've had some sort of major crisis, at the moment you're not always supported enough in your home to get well. We're going to invest a lot more money working with GPs in helping you to become well over the months since you get home. We're going to... That's pilot number 2. Number three, a major investment in equipment.
He's answering the question about pilots.
Mark Spencer talked about equipment being necessary to keep you well in your home. Well, that's right, because if you can't get safely down your stairs, you're more likely to fall down the stairs, break your hip, and end up in A&E. If we can invest serious sums of money in analysing people's homes and investing to keep them safe within them, we can help to keep people well. These are just examples of what's going on. In addition to, I'll just say 2 more things. In addition to working seriously to provide a 7-day-per-week health and social care system. So that if you come out of hospital and you need reablement care on a weekend, you'll have it in a social care space. If you need GP access 7 days a week, you'll have it because there are GP surgeries open for you. And if you need emergency care 7 days a week, you'll have that at these major emergency centres we've talked about. And all these things, ladies and gentlemen, it comes back to my first point. It's right for residents because it's better. It keeps them well. It keeps them well rather than patching them up when they're ill, and it also is good for managing a constrained budget. Because if we spend this extra money, it's extra money we'll spend down at this local level, we will be able to save money at the acute level. There will be less demand for acute hospital beds if people are well in their own homes, and that's what we're working for.
Right, you have a